All right. Good evening, ladies. Thank you very much for taking the time and coming out this evening to the Health Forum. I want you to imagine what your life would be like if you were telling stories to your grandchildren well into your 90s. My name is Dr. Tanya, and I'm a naturopathic doctor, and I dedicate my career and what I do to helping people achieve their health goals. And I use natural remedies and I use nutritional counseling instead of drugs and therapy to help people to be healthy and to create long-term healing. So that's what I do. My practice is in Menlo Park, as Charles mentioned. But tonight we're going to talk about how you can have a healthy brain for years and years to come. So you can share those stories with your grandchildren when you're in your 90s. So what we're going to cover tonight, go ahead, next slide. Actually, might be 2 slides. Okay, so today's discussion, these are some of the things that we're going to talk. So reasons why people's mind kind of loses its sharpness over age, 10 superfoods for your brain, secrets for keeping a healthy mind as you age, essential vitamins for your brain, and fun exercises you can do to keep your mind young. So reasons for cognitive decline. Oh, and before I continue, actually, at any time if you have any questions, please feel free to interrupt. I like to make these interactive, so anything at all that comes up, just feel free to ask.
I have a question.
Yes?
Are there any visible, obvious states of cognitive decline?
States within the U.S.? Oh, no. Oh.
If you're maybe introduce someone and you're overexcited, is that?
No, I don't think so. Not that I know of.
I recommend that you keep your questions.
Oh, okay, that's a good point. All right, so moving forward, reasons for cognitive decline. So there's diseases, so there's actual hereditary reasons or things that we get as we get older that can cause Alzheimer's. Is a very well-known one. So that's when you actually show buildup of plaque. They're called plaques in the brain, so certain parts of the brain that get plaques, and that kind of prevents you from causes your mind to deteriorate. Parkinson's disease as well. That's a hereditary disease, and that affects the dopamine centers in the brain. Dementia, so that's a little bit different than Parkinson's and Alzheimer's. This is something that can be hereditary and may or may not be. It can be caused from a variety of different reasons. So vitamin deficiencies. B vitamins are very important when it comes to cognitive health. And one of the things that can deplete B vitamins is drinking. So people who drink a lot or are heavy drinkers, they lose a lot of B vitamins, and there's a deficiency. It's actually called Wernicke's syndrome, and that's caused from a B vitamin deficiency from drinking, and that's when you'll see sort of an early onset of dementia. One reason. Having a low thyroid or thyroid problems can be another reason why we have dementia, can have an early onset. Certain medical conditions or medications, and a multi-infarct. So an infarct is, when you have a clot, you have all this vascular system in your brain, so you get a clot, and part of the clot stops the blood flow and then to an area of the brain which would cause damage. So that part of the brain becomes damaged, and then it doesn't necessarily mean that you'll lose memory. It just depends on where that infarct happens within the brain. If it's in an area that is involved with memory, then that's when you would see a decline in memory. So that would be, for example, if someone has a stroke and then they have memory problems. So that can be one of the reasons. And then there's a sort of a natural age-related decline. And then there's alcohol-induced. So this is, as I mentioned before, it's from a thiamine deficiency. So that's because B vitamins are water-soluble. A lot of drinking can cause you to lose B vitamins, which can affect your cognitive ability. So they say women should probably only drink about 1 drink a day, and men can have a bit of a higher tolerance, 2 drinks per day. That's kind of a safe level if you want to have a healthy brain long-term. Keeping the drinking down to a minimum is definitely an important part of that. Okay. So 10 superfoods for your brain. 1, blueberries. So one of the reasons why blueberries are so good is because they're high in antioxidants. And as you'll notice on your sheet, some of the things that I talk about are, so there's a list of the vitamins which will go into that, but blueberries are really high in proanthocyanidin. So fruit and vegetables that are really dark in color, so blueberries have got that really rich blue color. Any kind of vegetable that's dark in color has a lot of good nutrients, antioxidants, vitamins, minerals, that kind of thing. So blueberries are one of those superfoods that are really good for your brain. Beans. Beans are really good for your health, mostly because they have a lot of B vitamins in them. They also have zinc and some other minerals in them that are really important for brain health. Avocados. Avocados are really good for brain health because they have a lot of good fats. So your brain is essentially composed of neurons, and neurons are made of fat. So having enough good fats in your diet is really important for having good brain health. Avocados is one of those things that has good fats, and it also has vitamin E and a few other vitamins in it that are really good for you. Wild salmon, again for the same reason. And I say wild salmon because farm salmon isn't as good for you because it usually has a lot of, when they feed the farm salmon, they feed them pellets, and in the pellets there can be antibiotics and a lot of other things, contaminants that go into the fish. And farm salmon actually have normally their meat